In this lecture, we are going to learn about some fungal diseases that are common pathogens of humans. As you know that fungi are eukaryotic saprophytes and they are ubiquitous in nature, that means they are present everywhere. Although about 75,000 species of fungi have been identified, but only about 50 of them produces diseases in humans. Medical mycology is the discipline that deals with fungi that cause human disease. These fungal diseases are known as mycosis, and they are typically divided into five groups according to the route of infection, that may be superficial, cutaneous, subcutaneous, systemic, and opportunistic mycosis. Superficial, cutaneous, and subcutaneous are the infections that are caused by direct contact of skin, hair, and nails. And systemic mycosis are the fungal infections that have spread to visceral tissues, that means tissues that are surrounding the organs, or opportunistic, that may cause infections when conditions are favorable for them. The first one in this series, we are with due to there are many diseases as but we'll take only some of them. So first one is blastomycosis. Blastomycosis is the systemic mycosis that is caused by blastomyces dermatitis, a fungus that grows as a budding yeast in humans, but it can be grown as a mold in culture media in the environment. It is found in moist soil which are enriched with decomposing organic debris, and it is endemic in parts of south central, southeastern, and midwestern United States. Diseases, the initial infection begins when the blastospores are inhaled into the lungs, and then the fungus can spread rapidly, especially to the skin, where cutaneous ulcers and abscess formation occurs. This disease occurs in three clinical forms, that is cutaneous, pulmonary, and disseminated. That means that it is uh, profound in whole body. So diagnosis requires the demonstration of thick-walled yeast-like cells that are 8 to 15 micrometer in diameter, and then they can be isolated from the pus and biopsy sections of that infected area. There are other diagnostic tools as well, as you have learned about complement fixation, immunodiffusion, and skin test. They all are helpful for isolating these kind of fungus, and of course diagnosing them. Treatment includes amphotericin B, itraconazole, and ketoconazole. These are antifungal drugs, and they are the choice of treatment for this disease. And wherever possible, if there are large abscesses, then surgery is necessary. Mortality is not very high, it's only about 5%, and there are no preventive or control measures for it. The next one is cryptococcosis. Cryptococcosis is a systemic mycosis which is caused by Cryptococcus gattai and Cryptococcus neoformans. These fungi always grow as large budding yeast in the human host, but as smaller cells in the environment. They are saprophytes and they are worldwide distributed. Um, Cryptococcus gattai is responsible for nearly all cryptococcal infections in humans, whereas Cryptococcus neoformans infects those which are immunocompromised, such as the patients of HIV. Uh, the risk factors for this fungal disease is, of course, in immunocompromised patients, and it is found in almost 15% of AIDS patients. Others include cancer, organ transplant, etc. The fungi enters the body through respiratory tract and causing minor pulmonary infection in most cases. But those who have inhaled a high amount of the fungal spores, a pneumonia-like disease appears with coughing and fever, and then some of the pulmonary infection can also spread to skin, bones, viscera, and central nervous system. If it gets into the nervous system, then it can cause cryptococcal meningitis, a condition in which the membrane protecting the brain, that is meninges, they becomes inflamed and swollen. Those they actually, the source of infection appears to be the aged dried pigeon droppings. The birds are thought to be source of infection, and they are found in dried droppings of um, pigeon droppings. So, diagnosis is accomplished by the thick-walled spherical yeast cells, which are isolated from pus, sputum, or exudates, smears using Indian ink to define the organism. And the fungi can also be easily cultured on Sabura dextrose agar, and identification of the fungus in the body fluids can be made by immunological procedures. Treatment for Cryptococcus neoformans include amphotericin B, often with flucytosine. These are the cryptococcal neoforman cells. As you can see, this are the thick-walled, double-walled cysts that are appearing in the bloodstream of the patient. And this is against this the black background is actually the Indian ink, which is causing very luminous effect to these cells, so they can be easily identified. Prevention is the those patients who are infected with HIV are treated prophylactically with fluconazole, and prevention is through the avoidance of birds and um, areas which are contaminated with bird droppings. The next disease which we are going to cover is done or is transferred by direct contact, and these are known as direct mycosis. So cutaneous mycosis, which are also called as dermatophycosis, ringworm, or tinea. They are spread worldwide, and three of the genera of fungi are thought to be involved in this kind of infections. They are um, termed as dermatophytes, and uh, the genera which are involved in dermatophytes are Epidermophyton, Microsporum, and Trichophyton. Cutaneous diagnosis of these kind of diseases is through biopsied areas of the skin, which is cleared with 10% of potassium hydroxide, or by culturing the isolated specimen on seborrheic dextrose agar. Treatment includes uh, with treating the area with topical ointments such as miconazole, tolnaftet, or clotrimazole for 2 to 4 weeks. Glycofulvin and itraconazole are the only oral antifungal agents that are currently approved by the FDA for treating dermatophycosis. The infection caused by these fungi, they may be insidious, means they are growing in a stealthy manner. They are not you cannot see them, so they are insidious, or and the viable cells may be present in the shed skin cells, and they can survive for months or years. So, whatever treatment is included, that plan should also include thorough cleaning of bedding, carpets, and other substances that may contain those dead skin. So, hygiene is actually very important. The pathogens that are included in, or the, you can see, appearance of the disease occurs as tinea barba, which is an infection of the beard. Barba is a Latin word meaning beard. It is predominantly a disease of men that live in rural areas, and they acquire this fungus from infected animals. So the genera that are involved in causing tinea barba are Trichophyton mentagrophytes or Trichophyton verrucosum. Then occurs tinea capitis, which is an infection of the scalp hair. Capital is a Latin word meaning head, so it causes scaling, and it is primarily a childhood disease which is caused by Trichophyton or Microsporidium species. Poor hygiene is a cause of person to person transmission, and people who are living in overcrowded areas are also susceptible to this kind of mycosis. Then comes tinea corporis. Corpus is a Latin word meaning body, and it involves, it can occur at any, on any part of the skin. So they are characterized by circular red, well demarcated scaly lesions which is also accompanied by itching. They are also caused by Trichophyton and Microsporidium species. Direct transmission can occur also through infected animals or humans, or through fomites, that means inanimated objects. Then we have tinea pedis. Pes is a Latin word which means foot, and tinea menum. Menum is also a Latin word meaning hand. So these are the dermatophytic infections of feet and hands respectively. Symptoms include scales to pimple, tiny scales to pimple like eruptions, and itching is also present. It is most likely found in adults, and humidity, warmth, trauma, and occlusion of the areas increases susceptibility to this infection. Epidermophyton and Trichophyton species are responsible for tinea pedis and tinea menum. Then another presentation is tinea unguim. Unguis is a Latin word meaning nail. In this kind of infection, the nail becomes discolored and thick, and then nail plate rises, and it separates from the nail bed. Trichophyton species are responsible for it. These is tinea corporis. As you can see here, it is presented like this, kind of rings, appearing as rings in the body, and this is athlete's foot or tinea pedis. Then we have opportunistic fungal pathogens. Opportunistic fungal pathogens are those pathogens that can cause diseases whenever the environment is favorable for them. It includes candidiasis. Candidiasis is a mycosis which is caused by the dimorphic fungi, the Candida albicans and Candida glabrata. Candida albicans and Candida glabrata, unlike other pathogenic fungi, these are the members of normal microbiota that are living inside the body of humans, inside the gastrointestinal tract, respiratory tract, or vaginal area and mouth. In healthy individuals, they do not produce infections as they are suppressed by other microbiota and immune competency. However, if the anything upsets the normal microbiota, or if immune competency is compromised, then they multiply rapidly and causes candidiasis. They are important nosocomial pathogens. That means those person um, which are hospitalized, they can easily get this kind of infections. So in some hospitals, they may represent almost about 10% of the nosocomial bloodstream infections. The, they are also listed as the cause of sexually transmitted diseases. So, the first one in this opportunistic presentation of candidiasis is oropharyngeal candidiasis, which is commonly known as thrush. It is a common disease in newborns, persons with dentures, or people who use inhaled steroids. Usually, weakened immune system is the cause of candidiasis, and this small white flax covers the tongue and mouth. This is the thrush. As you can see here, the small white flags, they are covering the mouth and the tongue of the person, and they are budding like this. As you can see here, it's an electron micrograph, so you can easily see how they are budding inside the body. At birth, the infants do not have a normal microbiota in the oropharyngeal area. So, if the mother's vaginal area is heavily colonized by Candida species, then upper respiratory tract of the infant can get colonized, and thrush can be developed. So, but as soon as the infant gets its own microbiota, develops its own microbiota, then it becomes uncommon. Then we have intertriginous candidiasis, which involves those body areas that are warm and moist, for example, groin, skin folds, axilla, etc. The most common of this as can be seen as a napkin rash or diaper rash, and as diapers, if they are kept for a longer period of time and not frequently changed, then a certain kind of rash appears in that area, that is known as intertriginous candidiasis. Normally, the lactobacilli, which are the normal inhabitant of the vaginal area, they keep this pH low. And however, if the number of lactobacilli are reduced or decreased, then this yeast candida may proliferate, causing a curd-like yellow-white discharge from vagina, which is known as candidal vaginitis, and it is a result. It results in persons with diabetes or those which are on antibiotic therapy or oral contraceptives, pregnancy, or any other factor that compromises the female host, then vaginal candidiasis, candidal vaginitis can happen. Then we have another. The treatment includes, if the candida is in mouth, the oral thrush, then it can be treated with antifungal medicines. The treatment for mild to moderate infections in the mouth or throat is usually with an antifungal medicine applied to the inside of the mouth for 7 to 14 days. And these medication includes clotrimazole, miconazole, or nystatin. For severe infections, the most common treatment is fluconazole taken by mouth or through a vein. For candidal vaginitis infections, the treatment is an antifungal medicine which is applied inside the vagina with a single dose, or by taking a single dose of fluconazole by mouth. Other treatments may be needed for infections that are more severe and that do not, if the person is not getting better, or if it is relapsing, that is coming again and again, then these treatments can include more doses of fluconazole taken by mouth or medicines which are applied to the vagina, such as boric acid, nystatin, or flucytosine. Then we have another opportunistic, emerging opportunistic infection, which is microsporidiosis. Microsporidiosis, as you know, is an emerging infectious disease, and it is found mostly in HIV patients. That means immunocompromised patients. Several domestic and feral animals appear to be the reservoirs for these several species which infects humans, increasingly recognized as opportunistic infection agents. Microsporidia infect a wide range of vertebrates and invertebrate hosts. Microsporidian infections can result in a wide variety of symptoms, in which includes hepatitis, pneumonia, or skin lesions, diarrhea, weight loss, and wasting syndrome. That is the wasting of muscles. They are highly characterized by the spores, which are very resistant and can survive for a longer period of time in the environment. And this spore morphology resembles with enteric bacteria. Those spores which are recovered from human infections are oval to rod-like, having a dimension of 1 to 4 micrometer. They are The diagnosis is based on clinical manifestations and identification of the microsporidia in fecal smears. The fecal smear is stained with a specific technique which is known as chromotrope 2R method. Molecular identification can also be done by PCR, and you can see here like this one is being stained by the technique chromotrope 2R, and you can see easily how they are presenting here these microsporidial cells. And this one is an electron micrograph where you can see easily the tubule, the microtubule that it contains, and it is now anchoring on the host cell. Treatment of microsporidiosis is not well defined. However, some successes have been reported with the use of albendazole. Albendazole is an agent that inhibits tubulin or of ATP synthesis in helminths, and metronidazole, an anti-inflammatory agent, thalidomide, a toxic immunosuppressant agent, and fumigatin, which is an amebicide. Now we must have a quick recap. इन्फेक्शंस जो आपके यूजुअली फंजाई से होते हैं, दे आर नोन एज माइकोसिस, और ये ह्यूमंस में किस तरह से हो सकते हैं, सिस्टमिक भी हो सकते हैं, डायरेक्ट भी हो सकते हैं। जब आप स्पोर्स जो आपकी इर्द गिर्द मौजूद हैं उनको इनहेल कर लेते हैं सॉइल से, या फ्री लिविंग फंजाई जो मौजूद होते हैं उनको स्पोर्स को इनहेल कर लेते हैं, देन दीज काइंड्स ऑफ इन्फेक्शंस डेवलप इनसाइड द ह्यूमन बॉडी। सिस्टमिक इन्फेक्शन की अगर हम बात करें तो उसमें 4 टाइप्स होती हैं, जिसमें से हमने 2 कवर की हैं, ब्लास्टोमाइकोसिस, कोक्सीडियोडोमाइकोसिस, क्रिप्टोकोकोसिस एंड हिस्टोप्लाज्मोसिस, जिसमें से हमने 2 कवर की हैं। इसके अलावा क्यूटेनियस फंजाई होती हैं जो कि हेयर, नेल्स और आउटर लेयर ऑफ स्किन में मौजूद होती हैं, उनको हम डर्मेटोफाइट्स कहते हैं, और इन इन्फेक्शंस को हम डर्मेटोफाइटोसिस कहते हैं, या रिंग वॉर्म या टीनिया के नाम से हम जानते हैं। इसमें तकरीबन 7 टाइप्स जो हैं वो प्रेजेंट करते हैं, जिसमें से टीनिया बार्बा है, रिंग वॉर्म ऑफ द बियर्ड, टीनिया कैपिटस, रिंग वॉर्म ऑफ द स्कैल्प, टीनिया कॉर्पोरस, रिंग वॉर्म ऑफ द बॉडी, टीनिया पेडिस, रिंग वॉर्म ऑफ द फीट, टीनिया unguim, रिंग वॉर्म ऑफ द नेल्स, एंड टीनिया मैनम, द रिंग वॉर्म ऑफ द हैंड्स। इसके अलावा अपॉर्चुनिस्टिक ऑर्गेनिज्म हैं जो कि यूजुअली हार्मलेस होते हैं नॉर्मल एनवायरनमेंट में, लेकिन जब कोई भी कॉम्प्रोमाइज्ड होस्ट हो जाता है तो ये पैथोजेनिक बन जाते हैं, जल्दी से मल्टीप्लाई करते हैं रैपिडली और ओवरग्रोन हो जाते हैं, जिसकी वजह से इन्फेक्शन कॉज होता है। जिसमें से एक एग्जांपल आपकी जो अपॉर्चुनिस्टिक माइकोसिस की थी, कैंडिडाइसिस थी, विच कैन बी कॉज बाय कैंडिडा अल्बिकन्स और कैंडिडा ग्लैब्रेटा। और दूसरी इमर्जिंग अपॉर्चुनिस्टिक फंगल डिजीज़ हमारे पास जो है वो मौजूद है माइक्रोस्पोरिडिया, जो कि इम्यूनो कॉम्प्रोमाइज पेशेंट्स में होती है, सच एज HIV के पेशेंट्स या एड्स के पेशेंट्स, उनके अंदर ये इजीली इन्फेक्शन ग्रो कर जाता है। ये माइक्रोस्पोरिडिया में ये स्पोर फॉर्म में होते हैं, इनकी एक यूनिक ऑर्गेनील होता है जो कि कॉज कर रहा होता है इन्फेक्शन, दैट इज़ माइक्रोट्यूब्यूल, जो अभी आपको मैंने पीछे लिखा है यहाँ पर, दिस वन। ठीक है, इनका एक ख़ास मेथड होता है जिसके थ्रू इनको स्टेन किया जाता है, और दैट इज़ नोन एज क्रोमोट्रोप 2R, जिससे आपको ये नज़र आ रहा है फीकल स्मेयर्स के थ्रू. Now you can test yourself in what circumstances do a normal microbiota organism becomes pathogenic. A. Immunosuppressed patients such as those on chemotherapy or organ transplant. B. A teenager. C. People with diseases such as HIV, AIDS. D. Both A and C, and E. Both A and B. Think about it. Go through the lecture. जो चीज़ समझ नहीं आई उसको दोबारा पढ़ें, देखें, and then answer this question. If you do find any kind of difficulty, we can again come back in live session and you can ask there. Thank you so much for now. I will continue our lectures in the next session. Thank you.